Possible vertical transmission of COVID-19 from an infected mother to her newborn, reported at JAMA network on March 26, 2020. A 29-year-old pregnant woman who reported on January 28 with symptoms suggesting COVID-19. The diagnosis was confirmed with CT scan of the chest in addition to positive PCR on a nasopharyngeal swab. She also had antibodies that were positive for IgG and IgM on February 21st. There were 4 repeated PCR tests that were all positive. She delivered a girl on February 22nd through C-section. She was in a negative pressure room with N95 and she did not hold the infant. The neonate had no symptoms and was immediately quarantined in a neonatal intensive care unit. At age 2 hours after delivery, they did SARS CoV-2 IgG and IgM levels, and they were both elevated. Cytokines were also elevated. WBC count was 18,000. The neonate was transferred to Children's Hospital. At the same time, they did total of 5 PCR tests on nasopharyngeal swabs starting 2 hours after delivery till 16 days, and they all were negative. However, they repeated the serology with IgM and IgG, and they were still elevated on March 7th. The neonate was discharged on March 18th. At the same time, they did breast milk PCR testing for the virus, and that was negative on February 28th. On the mother side, her antibodies were still elevated on February 29th. So this is the first report of possible transmission of the virus through the placenta. And this is suspected based on the fact that the IgM antibody level was elevated in the neonate. And we know that the IgM does not transmit through the placenta. However, IgG does transmit. So the infant could have been exposed for 23 days from the time of the mother's diagnosis till the time of delivery. Usually, IgM does not appear in the infant after infection till 3 to 7 days. So that is unlikely that the infant was infected through the process of delivery. At the same time, they had PCR from vagina that was negative for the mother. However, the delivery was through C-section. There are some limitations of this case report, that it is only a single case, and there was no PCR done on the amniotic fluid or the placenta. We need additional examination of maternal and newborn samples to confirm that this is happening in those patients. Thank you very much.